So my job is I'm an intensive care physician, and the bread and butter of our emergency work is sepsis. And in sepsis, there's an imperative to get the right antibiotic into a patient as fast as possible. And that's in conflict with the growing risk of antimicrobial resistance. So the faster and the more readily we use antibiotics, the greater the risk of resistance, both for that patient and for the patient's family, the community and wider society. So we would ideally like to know what bug you've got when you're ill at the moment we come to make that decision. But that's impossible. It's impossible because the testing process takes time. We take blood, we put it in a tube, we send it to a laboratory who incubate and grow that blood, and when they see bacteria growing, they then plate them out and they identify them. That takes on average 2 to 3 days. So there is a window when we are flying blind and we're trying to make the best possible guess. That good guess isn't possible if you don't have the right information. So by getting the right information together, we now know that there are machine learning and AI tools that will help us select better antibiotics for those patients, both improving that patient's outcome and reducing the risk of antimicrobial resistance. The RADIX project is actually part of a wider programme of work. We're co-funded and working in collaboration with the University College Hospital Biomedical Research Centre, who have put together a package of work all around trying to demonstrate that we could start using data to drive and improve patient care at the bedside. So we're working beyond data, we're working directly with patients, we're trying to think about their concerns, how they'd like their antibiotic information made available to them. We're working with clinicians like Akish to ensure that the clinical teams have an opportunity to, again, guide and design the sorts of systems that we will build. And then we're working with public-private partnerships such as health services laboratories to think about the implementation step and about how we can actually take the models and the tools that we build and turn them into quality controlled and safe digital healthcare products that we can then steer through the appropriate regulatory pathways to actually have them put into daily use.
I think from the other side, as the clinician, I often spend hours looking at microbiology results, not only from my hospital, but maybe in through the London Care Record, or calling colleagues just up the road at the Royal Free or the Whittington or North Middlesex, just to try and get that full history for a patient so I can make that decision. So bringing all of that data together in one place will really, really help, not just from an AI point of view, but also from a clinical point of view at that bedside that Steve mentioned.
When somebody first spoke to me about the RADIX project, I genuinely felt that would be an absolute game changer. To be able to just have an app on the phone, or at one point where medics could go in and look at the antibiotics courses that I'd had, and as I say, the bacteria that I had that had infected me, would have been really helpful and would have saved a lot of time and resources from within the healthcare setting. Potentially, obviously I'm still sitting here today, but again could potentially be life-saving. As a patient, we can through this project, we can talk about our experiences of those things, which perhaps medics just don't ever see, because of course they're running at 1,000 miles an hour. As soon as the door closes for one patient, it opens for another.
So the antibiotic passport is the idea that hopefully that a patient would be able to, for example, show what antibiotics they've had in the recent past, which may make an impact onto what prescribing decision the clinician that they see may do. So that was one of our ideas in terms of a patient-facing way of the patient owning their own data.
So I genuinely think it's such an exciting and important project, because if I'm going to one trust and I'm just getting advice, thoughts, care based on all the data from that one trust, it's actually extremely narrow. The idea of obviously OneLondon and the secure data environment means that there'll be better care for patients.